Hello everyone. Today we're going to talk about medication or drug allergies. And we're going to go over several things. We're going to talk about what to watch for. How do you know if you have a medication allergy? What is a medication allergy? Why do they happen? We're going to talk about the diagnosis, how the doctor knows if you have a drug allergy. We're going to talk about ways to prevent them. And we're also going to talk about ways to avoid them. So this is an important subject that as pharmacists we deal with a lot. So what is a medication allergy? A medication allergy happens when your body thinks that the drug or medication you're taking is a foreign substance that's harmful to you. And so it starts to fight the medication. Now, it's very important to note the difference between a side effect or an adverse drug reaction and a drug allergy. They're not the same thing. A side effect happens when you take a drug and let's say you have nausea and vomiting. That's probably the most common. A drug allergy is different. It's when your body actually fights against the drug. So let's think about a drug allergy as your body, like I said, fighting against this medication. So your immune system sees this drug, it finds it as a threat, so it forms antibodies against this drug. Now, you may have an immediate reaction to this medication, or it may be what we call the delayed hypersensitivity reaction. So just because you take a drug one time and don't react to it doesn't mean you won't react to it in the future. And I want you to keep that in mind as well. We do know that certain medications are more likely to cause allergic reactions than others. Penicillins, antibiotics are on this list, as well as antifungal agents and non-steroidal anti-inflammatory drugs. So when it comes to allergic reactions, all drugs are not created equal. What are the symptoms of a drug allergy? How do you know if you are actually having one? Well, the most common or the first thing you'll normally see is a rash, or what we call hives, which are raised bumps on your skin. So if you take a medication and after some time passes, you start noticing a rash and you're itchy, that's a good indication you may have a drug allergy. Now, these rashes are not created equal. There's a big difference between just a regular rash, hives, and more intense rashes that can actually be life-threatening, such as Stevens-Johnson syndrome. So don't think that a rash can be safe, because at times it really can lead to harmful effects. The other thing that happens a lot of times is people with drug allergies have problems breathing. So kind of like when you have an asthma attack, you can't breathe. If you start not being able to breathe after you've taken a medication, you need to have someone to take you to the emergency room immediately, because that's a sign that you're probably going to need epinephrine and Benadryl to pull yourself out of the allergic reaction. Other things that can happen is you can have some GI effects from allergies, but normally those are more of an intolerance than a true allergy. There can be some fever and joint pain, and the most severe is what we call anaphylaxis or anaphylactic shock. And this normally happens minutes after you take the medication. Your face swells, your throat closes up, you have problems breathing, your blood pressure drops, and this is definitely a medical emergency and something that you have to be seen for right away, because it can be deadly. How do our physicians diagnose medication allergies? Well, the most important way to do it is from the patient, you telling them that you have the allergy. So that would be number one. Whenever you go to the doctor, make sure you tell them what your allergies are and tell them what happens when you take them. So there's a big difference between well, I take codeine and it gives me a stomach ache, or I take penicillin and I can't breathe and I go into anaphylactic shock. So make sure they know what actually happens to you. That's number one. A good medical history really can help the physicians. Another thing we can do is skin testing, so allergy testing. Now, I had this done when I was younger. They basically inject you with small little amounts of different things. A lot of times it's not medications. Medications can be involved, but they might do like grass and hay and horses and stuff like that just to find out what you're actually allergic to. So that's pretty common. If you are in a situation where you really need a penicillin, for example, and you're allergic to penicillin, sometimes we will do a drug challenge in the hospital where we'll give you just a small amount of the drug to make sure you're really allergic to it. And the reason we do this is for two reasons. One, penicillins work better than other drugs for a lot of infections. But two, a lot of people that think they're allergic to penicillins, especially older people, are not really allergic to the drug itself, but they're allergic to what was put in the penicillin or the byproducts of the penicillin medications that happened years ago. Just because you've been allergic to penicillin in the past doesn't necessarily mean you're still going to be allergic to penicillin now. And we have more drugs in the penicillin class now, and they don't all cross-react. So, for example, ceftriaxone is a penicillin-like drug. It's a cephalosporin, but it rarely cross-reacts with people who have penicillin allergies. How do we prevent drug allergies? Well, as consumers, the most important thing is letting your providers know that you're allergic to medications, letting your pharmacists know that you're allergic to medications, because some drugs that aren't even really related, at least not in your mind or even the doctor's mind, may cross-react because certain parts of the molecule that is the drug may be similar in different drugs. So as pharmacists, we really need to know what you're allergic to. And our computers will tell us if something's very close or there's a risk. Now, as a pharmacist, what do? Well, I work in a hospital. So if I see that, say the doctor orders penicillin and a warning pops up on my screen saying patient's allergic to penicillin, the first thing I'm going to do is I'm going to look to see if the patient has had penicillin in the past. If they have had it and didn't have a reaction, and it happened since the actual allergy was put into the computer, then I'm going to think it's probably fine. If I can't tell, I'm going to go talk to the patient. I'm going to ask them, what happens to you when you take penicillin? If they say I go into anaphylactic shock, I'm going to call the doctor and I'm going to get the drug changed to something else. So letting your healthcare providers know that you're allergic to something is step one. Step two, and I always recommend this even if you don't have allergies, is make sure you keep a list of your medications with you at all times. Whatever you're taking, you should have with you. Because if something happens to you and you end up in an emergency room and you're unconscious or you can't communicate, you want them to be able to see what you are taking. And make sure you list your drug allergies on there. Make sure you list nutritional supplements on there and any over-the-counter drugs you take as well. If you are somebody who gets anaphylaxis to drugs, it's a good idea to get a medication bracelet that can tell people, hey, I am allergic to penicillin. This is also important if you have diabetes or some other health issues, but if you are severely allergic to something, make sure you wear one of those bracelets because it can really save your life in a situation where you can't communicate and you need medical treatment. Be sure you read the labels carefully. You know what you're allergic to. If you see something that you have any question about on the label of your medications, be sure to check with your pharmacist. The pharmacist should be able to tell you if there's any risk at all of you reacting to these drugs. And if you don't want to talk to your pharmacist, send me an email, michael@pharmacistmichael.com, and I will be happy to look it up for you. How do we manage medication allergies? Well, there's a few different things we can do, and the first thing is to avoid whatever the allergen is. Avoid whatever the medication is that you're allergic to. That's the simplest way to not have a drug allergy. If you're allergic to one drug, you're probably allergic to more than one drug, so you may try something new and you may react to it. So always keep that in mind. Another thing we can do is develop a safety plan with our physician. If you are somebody who is allergic to medications or even bee stings, it's a good idea to get a prescription for an EpiPen, which is just a little pen with epinephrine in it that you can inject yourself with if you start going into anaphylaxis. That can definitely save your life. So don't forget to talk to your doctor about ways to treat your medication allergy if you're someplace where you can't get to a hospital or a doctor's office very quickly. Be sure to look for medication alternatives, right? This is really the same or very similar to avoiding the allergen, but think about other medications or talk to your pharmacist about other medications that you can take, especially when it comes to over-the-counter stuff. So if you're allergic to ibuprofen, obviously you don't want to take ibuprofen. Can you take naproxen? Maybe, maybe not. I probably wouldn't suggest it, but you can probably take Tylenol. So that's just an example of things you can do to avoid the medication itself. And educate yourself. It's always important to educate yourself about medications and allergies and anything else that you are experiencing in your life, right? Educate yourself about your conditions, your allergies. Watch videos like this. You can do Google searches. I don't recommend putting a lot of stock in there unless it's a very reputable website, though. You got to be careful when you search on Google because you can end up really scaring yourself. Google is not always the best way to get information, but educate yourself. Talk to your doctor. Talk to your pharmacist. Do legitimate research. Medication allergies are a concern, and it's important to take necessary steps to keep yourself safe. Be sure to let your doctors know, let your pharmacist know what your allergies are. Be sure you know what they are. Carry a list of medications with you. If you are somebody who develops anaphylaxis to certain medications, wear a bracelet, carry an EpiPen with you, just in case you can't get to the doctor or hospital in time. It's important that we advocate for our own medical care. If you have any questions about drug allergies, or really anything involving medication at all, you can email me at michael@pharmacistmichael.com. If you've enjoyed this video, please give it a thumbs up. Please subscribe to our channel for more happy, healthy living information. Take a look at some of the links that I've put down in the description section of this video for you. My name is Pharmacist Michael. Be happy and be healthy.